This upper limb region, it is considered as an appendicular part along with lower limb. So on the whole of our body, we have two parts as appendicular part. One is upper limb and another one we will call as lower limb. So in this class, we are going to deal about upper limb region. So about upper limb region, we are going to cover in this session about the bones of upper limb, muscles, vessels and nerves present in this particular region. And foremost, we have to know a basic orientation of upper limbs orientation and how it is arranged. The things such as muscles, nerves, vessels and the bones, the orientation of the arrangement of these things will give you a better knowledge to learn about this upper limb part in a easier way. So now we will move on to its orientation in a detailed account. In upper limb part, we are going to see two important bones in the uppermost part. So we are dividing the whole of the upper limb into four regions, such as we will be having axilla part, and then we will be having pectoral region, and then we will be having arm part, forearm part and hand region. So under these five headings, we are going to divide the upper limb, and then we are going to read details about this parts in a very easier way. So first region we are going to cover is pectoral region, and then after we will move on to axilla region, then it is descending downwards as arm, forearm and hand region. So first, dealing about pectoral region, we will be having three muscles present in the pectoral region. About the details of these muscles we will deal later. Now just understand, we have pectoral region with three muscles in its presence. So we have first muscle as pectoralis major muscle, then after you will be having another muscle just below it. This we will call as pectoralis minor. So this we will call as pectoralis minor, and later we will be having another muscle which is just present above or just present above these two pectoral muscles or just below the clavicle bone. So this muscle we will call as subclavius muscle. So this is a subclavius muscle which you are seeing just below the clavicle. You can make out this clearly. So in this image you can see this. So here you can make out. So in pectoral region, three muscles we have dealt. One is pectoralis major, which is present superficially. Then after we will be having pectoralis minor. Later we will be having just below the clavicle another small muscle we will call as subclavius. Before that, you have to know it is a dissected part what you are seeing here. So this is a 3D orientation what I am teaching you now. But first we have to know we'll be having some layers in our body such as skin. Then after we will dissect it out. Later we will approach superficial fascia, and below this superficial fascia we will be having deep fascia, and below the deep fascia we will be approaching the muscles. So under these headings we will be going, and after the muscles only you will be getting some bones, and these muscles we will be having some vessels and nerves supplying to these muscles and all. About those minute things and all we will study detailedly later. Now just to understand how it is oriented. So pectoral region in upper limb have three muscles which we see now. One is pectoralis major, another one is pectoralis minor, and the third muscle what you are seeing here is subclavius muscle. Now the bone which is present related to this pectoral region is clavicle. So the bone what you are seeing is clavicle bone, which is a very important bone and the first bone you are going to learn in anatomy. So this bone we will call as clavicle or collar bone, and this is considered as a beauty bone also, which you may hear before only. So this is a clavicle and which is present horizontally. So this is the one bone which is present horizontally. So now we will deal with other regions of upper limb. So pectoral region, I think you people are oriented with three muscle and one bone will be seen. So now we are going to see back of this same region. So back of the pectoral region you will be having shoulder region. So this will be considered as shoulder region. Just behind we will be having shoulder region. So this is considered as shoulder region. In shoulder region we will be having first muscle as trapezius. So this is also a muscle of upper limb from back region, we have first muscle as trapezius muscle, and once you remove this trapezius muscle, you will approach some small muscles, such as just below the trapezius we will be having levator scapulae in the upper part. Then after we will be having rhomboides minor and rhomboides major. So first muscle what we see in is trapezius muscle, and below layer of trapezius we will be having three muscles from above downwards. One is levator scapulae, another one is rhomboides minor, and below that rhomboides major will be seen. And now coming to the lateral aspect of the same area, that is back region, we will be having some other muscle that we will call as, so we will be having, before going to muscle details, you can see a part of bone which is hidden out by these muscle covering. So that bone we will call as scapula, which is again an important bone in upper limb. So clavicle, it is a bone seen in pectoral region, and now you are seeing backbone, that is scapula, which is an example for flat bone. And this scapula bone, it is covered posteriorly by some muscles, such as above we will be having supraspinatus and below we will be having infraspinatus. Just below the infraspinatus you will be having teres major muscle. So these are the muscles which you will approach in the lateral aspect of the back region after removing the trapezius muscle. And just below the trapezius you can see another important muscle, that is latissimus dorsi. So we can divide the back region as superficial layer and deep layer. In superficial layer you have trapezius, and below we'll be having latissimus dorsi, and in the deeper layer we have levator scapulae, rhomboides minor, rhomboides major in the medial aspect, and lateral aspect we will be having supraspinatus, infraspinatus, and then we will be having teres major muscle. So these are the muscles seen in the back region of upper limb. Now we will approach the bone directly. So once you remove the supraspinatus, infraspinatus and teres major, now you can see clearly the scapula bone. So this is the scapula bone which is present in the back region of the upper limb. So this scapula bone, if you are seeing, we will be having another muscle also attached to this scapula. So this muscle we will call as deltoid muscle. Some of you might have heard this muscle. This muscle is the muscle which is used for intramuscular injection. So deltoid muscle, which is seen in the shoulder region, covering a joint called shoulder joint. We will approach about those later. Now you just remember we have a muscle in shoulder joint, and it is an important muscle which is used for intramuscular injection, and we will call this as deltoid muscle. So once you remove this deltoid muscle also, you can see the bone clearly. So this is the posterior aspect of the scapula. So posterior aspect of the scapula with a process you can see, that is spinous process. So posterior surface of scapula will be carrying a process called spinous process, which is ending up in another process called acromion process. So scapula posterior surface with two process, one is present just behind it, that we will call as spinous process, and laterally we have acromion process, which is going to articulate with the anterior bone, that is clavicle. So this joint we will call as acromioclavicular joint. So that's all about the details you have to know about the bones here. Now we have a bone here also. So that bone we will call as humerus. So humerus upper end, it is going to articulate with this scapula to form a joint called shoulder joint. So this joint forming a demarcation which is giving pectoral and back region, or which is separating the pectoral and back region from the appendicular part of upper limb. So we'll be having other three regions present outside it, that is arm region, forearm region and hand region. So now we will deal with those muscle. So now you can arise a question, what is this small muscle? So we have seen teres major in the deep layer, right? Just deep to that we will be having another accompanying muscle of this teres muscle, that we will call as teres minor, because of its small size. So this is teres minor, and above that we have teres major muscle. Now we will approach the other regions. So if you see the anterior aspect, in anterior aspect if you are seeing, we can make out again arm region clearly. So we are dividing the whole of upper limb into three joints. So we'll be having three joints which is going to give some regions specifically. So the regions we will divide now, that is first region is first joint is shoulder joint. So this is shoulder joint. You have to remember, we have shoulder joint which is going to divide the two regions. So that is pectoral region from the arm region, which is divided by this shoulder joint. So this is a joint which is used for, which is we will call as shoulder joint, which is again covered by a muscle called deltoid muscle. Now we have another joint present that we will see here. That joint will be called as elbow joint. So this joint will be called as elbow joint. So this is a joint which is going to separate arm region from the forearm region. So this is arm part, this is forearm part, which is separated by a joint called elbow joint. And another joint will be seen near to the hand region, and that joint we will call as again wrist joint. You might have heard this. So wrist joint, it is a joint which is going to separate forearm from the hand region. So these are the three regions we have to remember. One is arm region, and the one forearm, and then we have hand as a distal part. Always remember, near to the body we will call as proximal part, and away from the body we will call as distal part. And all the positions you must remember. So this we will call as anatomical position of the human body. So this is anterior aspect. So in anterior aspect we are going to see about arm region. Before that we have the bone here, right, that is humerus. Between the humerus and the ribs of the thoracic region we have a space called triangular space. That space will be called as axilla, and about the details of axilla we will deal later. Just to remember, we have a region present here we will call usually as armpit. In anatomy we will call it as axillary region. So now we will approach the arm region. In arm region we have again anterior aspect and posterior aspect. So we will divide as anterior and posterior part of arm region. So these two parts are divided by septum present in the lateral and medial surface. So medial part or medial border of the humerus, it is giving a attachment to ligament called medial intermuscular septum. Same way laterally we will be getting lateral intermuscular septum, which is dividing the whole of muscle into two compartments, anterior compartment and posterior compartment. So now we will deal with anterior compartment of arm. Talking about the anterior compartment of arm, the first muscle what you are seeing is biceps brachii. So anteriorly the muscle which you are seeing is biceps brachii. Why we are calling this as biceps brachii is because of its two heads. You can view here. So one will be called as short head, and another will be called as long head. So this muscle will be considered as a muscle of anterior compartment, biceps brachii. Here you have to remember arm region is otherwise known as brachium region in upper limb. So arm region we will call as brachii, and the muscle which have two heads we will call as biceps. So biceps brachii is the first muscle seen in the anterior compartment. So once you remove this biceps brachii, you can approach other two muscles, such as one muscle present in the lower part we will call as brachialis. As it is seen in the brachium, we can call this as brachialis muscle. And one more muscle seen in the upper part we will call as coracobrachialis. Name itself indicates it is arising from coracoid process of scapula. We already dealt two processes in scapula, that is spinous process and acromion process. Now you have another process called coracoid process. So from the coracoid process we have attachment of this muscle. So we are calling this muscle as coracobrachialis. So coracobrachialis is the third muscle which is seen in the anterior compartment of arm. So in anterior compartment of arm, we are dealing with three muscles such as biceps brachii, coracobrachialis and brachialis muscle. So now we have dealt with these muscles here. Now we are going to see posterior compartment of arm region. So already we had dealt with anterior compartment, three muscle. Now in posterior compartment of arm, that is between the shoulder joint and the elbow joint, this region we will call as arm. In arm posterior aspect, we have only one muscle present, and that muscle we will call as triceps brachii. So biceps, in the sense we have two heads, so here it is triceps, so obviously we will be having three heads of triceps, three heads of this muscle will be seen. So we are calling this as triceps brachii. So this triceps brachii again will be having two heads which are seen superficially. One is long head and another one is lateral head, and then just below this we will be having another muscle present, that is present deep layer, so we will call that as medial head. So long and lateral head will be seen clearly here, and once you dissect these two heads you can make out the medial head clearly. So once you have finished all these muscles, that is in anterior compartment three muscle and posterior compartment one muscle, that is triceps, you can make out the bone clearly which is present in the arm region. So the bone which you are seeing here is humerus bone. So this is a single bone which is present in the arm region. So this is humerus bone, and this humerus bone, it is going to contribute for two joints. One is for shoulder joint and another one is for elbow joint. Now we are going to see about the forearm region. So we are talking about forearm region, that is a region which is present between elbow joint and the wrist joint. So now we are going to deal with this forearm part that is present between these two joints. Forearm part is again divided as anterior and posterior compartment as like arm region. So anterior compartment, always remember, it is used for flexion action. So in arm and forearm we will call anterior compartment muscle as flexor compartment muscles. Same way posterior compartment is mainly used for extension action, so we are calling that as extensor muscles. So in the forearm region we'll be having altogether 8 muscles seen in the anterior compartment. So those 8 muscles we will divide into superficial, middle and deep layer. Superficial we will be getting 4 muscles, in the middle layer we will be getting again one muscle, and in the deeper layer we'll be getting 3 muscle. So all these muscles we will deal later detailing. So the highlighted muscles what you are seeing are flexor muscles of the anterior compartment of forearm. So anterior compartment only we are calling as flexor compartment. The muscles which are highlighted here will be known as flexor compartment muscles of the forearm region. So here you can make out these are the bunch or group of muscle which are called as flexor compartment muscle. So these are the flexor compartment muscles. Now we will move on to extensor compartment muscle, that are again 12 in number, and that is again divided into superficial and deep layer. Superficially we will be getting 7 muscles, and in the deeper part you will be getting 5 muscles. Altogether we will be having 12 muscles seen in the forearm region. So here you can make out, so these are the bunch of muscles which are going to form extensor compartment of forearm. So altogether you will be getting 12 muscles seen in the extensor compartment. So these all about the details of forearm region muscles. So from the elbow joint till the wrist joint we will be calling this as forearm. Anterior compartment and posterior compartment will be seen. Anterior compartment we will call as flexor compartment. Posterior compartment will be called as extensor compartment. Anterior compartment will be having 8 muscles and posterior compartment will be having 12 muscles. About the details of these muscles we will deal detailedly later. Now you just understand how it is oriented. Now you have to remember one more thing. In arm region we will be getting one important artery that we will call as brachial artery. The same artery, it will continue downwards and divide into 2 arteries that we will call as radial and ulnar artery. Why we are calling it as radial and ulnar artery is we will be having bones present in this region, that is radius and ulna. So the humerus is the bone which is seen in the arm region. Now we are going to see bones present in the forearm region, which we will call as radius and ulnar bone. So lateral bone which you are seeing is radius, and the medial bone which we will be seeing is, which will be dealing is, that we will call as ulna. So the bones you can see clearly here, I think. So this is the two bones which is present in the forearm region, and here you can make out. So these are the two bones which is present. This is the posterior aspect you are seeing here, and this is the lateral wall and lateral border, and this is the medial border. The lateral bone which you are seeing we will call as radius, and the medial bone we will call as ulna. So that's why the brachial artery branches according to the corresponding bones we will call as radial artery and ulnar artery. So this is the ulnar bone which is present medially, and this is the radius bone which is present laterally. And now we will approach the another joint that we will call as wrist joint. So the carpal bones will be seen here, and we will call this joint as wrist joint. And outside or distal to this wrist joint we will be having another part we will call as hand region, and that hand region again we will divide into palmar aspect and dorsal aspect. The what structures you are seeing here is, again we will call as dorsum of hand. As it is posterior, we can call this as dorsum area. So this is the dorsum area. See, in this you can view clearly. So this is dorsum of hand. In dorsum of hand you can see many structures such as superficially, after removing skin, superficial fascia and deep fascia. That is, you can make out one thickening of deep fascia we will call as extensor retinaculum, and then we will be getting some veins. That vein we will call as dorsal venous arch because of its arch like formation. So this is dorsal venous arch, and then we will be getting again muscles present just below it. We'll be having many cutaneous nerves and all. We will deal later about those things. So the muscles which are seen in the dorsum area we will call as dorsal interosseous, because between the two bones it is seen, so we are calling it as interosseous muscles, and it is present in the dorsum region, so we are calling it as dorsal interosseous muscles. So that's all about the dorsum of the hand. Now we will approach palmar aspect. So here you are seeing palmar aspect of hand, that is anterior surface. In anterior surface, first thing what you are seeing is palmar aponeurosis. So it is again a thickening of deep fascia. As we seen like extensor retinaculum in the posterior aspect, we will be having two thickening. One is flexor retinaculum, and another one we will be having palmar aponeurosis. So after removing this palmar aponeurosis in hand region, you can make out an arch. So that is arterial and venous arch we will call as superficial palmar arch and superficial venous arch. So those superficial arterial arch and superficial venous arch will be seen, and later we will be having tendons coming from the forearm region and muscles, and later if you remove those things you can approach the muscles clearly. So if you remove all the tendons and the ligaments and all, you can see some muscles seen in the palmar aspect, and those muscles we will call as intrinsic muscles of hand. So these intrinsic muscles along with dorsal interosseous muscle, we will be having around 20 muscles seen in the hand region. So this is lateral aspect, so we'll be having lateral muscles we will call as thenar muscles, and here in the medial aspect we will be having hypothenar muscles, and here we will be having worm like muscles, small muscles we will call as lumbricals. Along with that palmar interosseous and the dorsal region we seen some group of muscles we will call as dorsal interosseous. So in the hand region we are going to see details about these all muscles along with the some vessels arch such as superficial palmar arch and deep palmar arch, and the nerves supplying the whole of the upper limb together. So all these things you have to remember, and this is all about the orientation of upper limb, how it is present in our body. And along with that we are going to see details about some regions also, such as we will be having breast or mammary gland glass, and along with that we are going to deal about pectoral region, axillary region, and the muscles of back region, scapular region, and the arm muscles in detailed account, along with forearm muscles and hand region. And then we'll be having simpler way of learning nerves present in our body, along with anastomosis such as scapular anastomosis and elbow anastomosis according to the regions. So these are all about the orientation of upper limb. So after you know or you have a better idea of this orientation, we will approach the classes. Then it will be easier for you to understand upper limb in a very easy manner.